health tonight. A very busy week in local doctors' offices with one illness in particular spreading pretty fast.
Dr. Frank McGeorge here with a look at what's going around and what is getting worse. Doc?
That illness is strep throat. Now, several doctors are reporting an increase in patients suffering from strep throat. And while the flu is still a big problem, we're also seeing the first hint of spring illnesses, too. Here's what's going around where you live. In Wayne County, Children's Hospital says RSV and asthma flare-ups top the list, but strep throat is on the rise. Garden City Hospital is treating flu and stomach viruses, and pediatricians at Henry Ford and Dearborn are seeing kids with colds and also strep throat. Over to Oakland County, Dr. Kelly Levasseur at Beaumont Children's is treating influenza, strep throat, and stomach viruses. Providence Hospital in Southfield says the warmer weather is making allergies flare and asthma, too. The CVS Minute Clinic in Walled Lake reports a case of fifth disease. That's a viral illness that causes a lacy rash that gives the appearance of a slapped cheek. Bronchitis and pink eye are also popping up. West Washtenaw County doctors at U of M report lots of sick kids this week with respiratory illnesses causing a bad cough and a number of stomach viruses, too. The health department says flu-related hospitalizations remain at high levels, especially in seniors. Influenza A continues, but they're seeing influenza B more frequently, too. Heading to Monroe County, ER doctors at ProMedica Monroe Regional are also seeing A and B strains of the flu and also strep throat in children this week. Finally, in Macomb County, Dr. Patrick Flaherty at McLaren Macomb reports he too is seeing a rise in cases of influenza B and high levels of stomach virus. The change in temperature is bringing more asthma and croup in young kids. Beaumont Dr. Parag Patel is seeing sinus infections, and all of the Henry Ford Macomb health centers are treating strep throat. Now, strep throat causes a fever, sore throat, and often pain with swallowing. A cough is not common with strep throat. Now, in fact, not every sore throat or even strep throat needs antibiotics, but you should see a doctor if there's significant difficulty swallowing, any trouble breathing, swelling or lumps in the neck, or if you just aren't getting better after a few days. Back to you.
All right, Doc.